Thank you very much, Mr. Speaker. I rise to oppose the Marsico Amendment. You know, during the budget appropriation hearings, I applaud the Secretary of Health, Secretary of Drug and Alcohol, and the Physician General. For 2 years in a row, they've testified that the number one public health threat to Pennsylvania is drug abuse, substance abuse, drug overdoses. And unfortunately, we have somewhere between 8 and 12 people every day in Pennsylvania dying of drug overdose deaths due to addiction. And here we are. We've done so much good in the Commonwealth of Pennsylvania with the prescription drug monitoring program. We've passed a lot of laws getting tough on drugs. And yet, I find it amazing that while we recognize we're in the midst of one of the worst drug crises in history, we're now looking to legalize the most illicit drug in America and in Pennsylvania, marijuana, a Schedule I drug. This is not good public policy. This is going to hurt a lot of people. And so I rise to review this legislation with the combined expertise of nearly every major medical association in Pennsylvania that opposes Senate Bill 3 and the Marsico Amendment. And some of those groups that oppose Senate Bill 3 and the Marsico Amendment is noteworthy. The Pennsylvania Medical Society opposes this amendment and Senate Bill 3. The American Medical Association opposes this amendment and Senate Bill 3, and actually was quoted as saying marijuana is a dangerous drug. The American Academy of Family Physicians oppose this amendment and Senate Bill 3. The American College of Physicians, the American Psychiatric Association, the American Academy of Pediatrics, the American Academy of Neurology, the American Epilepsy Society. Let me repeat that. The American Epilepsy Society opposes this amendment and Senate Bill 3. Multiple Sclerosis Society opposes Senate Bill 3 and this amendment. The American Cancer Society, the American Society of Addiction Medicine, the American Glaucoma Foundation, the National Eye Institute, the American Academy of Ophthalmology, the American Lung Association, the American Academy of Child and Adolescent Psychiatry, the National Drug Court Professionals. All of these organizations oppose this amendment as it's outside the FDA approval process. The National Institute for Neurological Disorders and Stroke, and many other organizations, the Drug Free Schools Coalition, oppose this amendment and Senate Bill 3. National Families in Action, Momstel, Communities That Care Southeast Regional Education Outreach Committee, SAM, Smart Approaches to Marijuana. And I want to give a shout out to this particular organization because the co-founders, Patrick Kennedy of the Kennedy family and Kevin Sabate and their attorney have been very, very instrumental in helping me prepare some remarks over the course of this discussion. Parents opposed to pot oppose this legislation. Citizens Against Legalizing Marijuana. The International Faith-Based Coalition oppose this legislation. National Council on Alcoholism and Drug Dependence. The Save Our Society from Drugs. The Pennsylvania State Nurses Association. Pennsylvania Society of Anesthesiologists. The Pennsylvania Allergy and Asthma Association, the Pennsylvania Neurological Society, the Robert Ivy Society for Plastic Surgeons, the Pennsylvania Society for Pulmonary Disease, the Pennsylvania Rheumatology Society, the Pennsylvania chapter of the American College of Cardiology, the Pennsylvania Occupational and Environmental Medical Society, the Pennsylvania chapter of the American College of Physicians, the Pennsylvania chapter of American College of Emergency Physicians, and, among others, Pope Francis, who calls what we're trying to do today, and he said this in Philadelphia, a failed experiment. Mr. Speaker, I'd like to go over this particular amendment since this workforce group proposed this amendment, and it has several flaws, many fatal, many illegal under federal law. And I'd like to go over those now. The bill violates the FDA process that has protected us for over 100 years. The FDA is the sole federal agency that approves drug products as safe and effective for intended indications. The Federal Food, Drug, and Cosmetic Act requires new drugs be shown to be safe and effective for their intended use before being marketed in this country. FDA's drug approval process requires well-controlled clinical trials that provide for the necessary scientific data upon which FDA makes its approval and labeling discussions and decisions. If a drug product is to be marketed, it is best to be disciplined, systematic, scientifically conducted trials to obtain data to ensure that the drug is safe and effective when used as indicated. Efforts that seek to bypass, and that's what we're doing here today, we're bypassing the FDA approval process, do not serve the interests of the public health because they might expose patients to unsafe and ineffective drug products. Anecdotal reports are not accurate, nor should they be considered reliable. The anecdotal reports regarding medical marijuana are not reliable scientific evidence because they claim benefits were not independently verified and do not reflect double-blind controls. The anecdotal reports may also be inaccurate due to the emotional expectancy of the person using marijuana and the placebo effect. In some cases, there may be deliberate exaggerations for ideological reasons. Violations of federal law. Marijuana as medicine in many ways violates federal law in that the medical marijuana dispensaries or persons such as physicians, government employees, landlords, and others acting under the state medical marijuana law may be subject to prosecution by the United States government under the Controlled Substance Act because state medical marijuana laws are preempted by the Federal Controlled Substance Act. Congress enacted the Controlled Substance Act for the purpose of consolidating various drug laws into a comprehensive statute to determine enforcement tools against interstate and international drug trafficking. Racketeering, Influenced and Corrupt Organizations Act, RICO. Dealing in marijuana is illegal under federal law and a racketeering activity under the federal RICO law. Those who engage in a pattern of racketeering activity through a corporation or other enterprise are liable for 3 times the economic harm they cause, plus costs and attorney's fees. And those who conspire with racketeers by agreeing to assist them are likewise liable. RICO also gives federal courts the power to order racketeering enterprises and their co-conspirators to cease their unlawful operations. The RICO statute also gives rise to a civil cause of action which may be brought by a private citizen injured by the racketeering activity. There are currently RICO lawsuits against medical marijuana programs. Anyone who participates in the growing, possession, manufacturing, distribution, or sales of marijuana under state laws, or aids or facilitates or finances such actions is at risk of federal prosecution or other liability under RICO.
Sir, would you please suspend? Members, there are not many individuals who have asked to speak on the amendment. I'd ask all the members to please take your seats. Please take your seats. If there are any conversations, just please take them to the anterooms off the chamber. As I've indicated, it's Representative Baker, followed by Representative Miccarelli, and then Representative Gainey. Would all members please take your seats? And if there are any conversations, just please take them to the anteroom. But I'd ask members to please take your seats. Representative Baker, you may proceed.
Thank you, Mr. Speaker. So moving to Section 103 of the Marsico Amendment, it defines the department as the Department of Health of the Commonwealth, form of medical marijuana. The characteristics of the medical marijuana recommended or limited for a particular patient, including the method of consumption and any particular dosage, strain, variety, and quantity or percentage of medical marijuana or particular active ingredient. Goes on to say medical marijuana for medical use is set forth in this act. The two above definitions appear to allow any form of marijuana to be used in Pennsylvania. Section 3013, develop a 4-hour course for physicians regarding the latest scientific research on medical marijuana, including the risks and benefits of medical marijuana, and any other subjects deemed necessary by the department. That's the Department of Health. The marijuana industry lobby should have no control over this course lest it turn their platform for their commercial interests. The industry can provide input, as can anyone else, but should not sit on any body that has control over the course. The course is only for 4 hours, which is not enough to convey all the information, and there should be well-prepared materials to go with it. The educational content of such course must include pharmacology of marijuana, contraindications, adverse reactions, side effects, overdose prevention, drug interactions, dosing, routes of administration, risk and benefits, warnings and precautions, abuse and dependence, and other such components are determined by the Commissioner. This information should include indications and usage, use in specific populations, overdosage, description, non-clinical toxicology, clinical studies, references, how supplied, storage and handling, patient counseling information, federal law, it should include that, the Controlled Substances Act and the FDA and the DEA rules. This information does not exist for marijuana. Why? It's illegal under federal law. So it'll be interesting to see how they actually do this. Section 301, subsection 4, develop a 2-hour course for principals and employees of medical marijuana organizations who either come in contact with patients or caregivers or who physically handle medical marijuana. I hope when they're explained this, they're told that they're violating federal law. Section 301, subsection 6, establish a manner and method to administer research studies to be operated by vertically integrated systems. and to collect research data on the use of medical marijuana. So what are the costs of that going to be? Are the taxpayers going to have to pay for that? What kind of bureaucracy is going to be created? How much taxpayer dollars is that going to cost? Is there a fiscal note for this kind of requirement contained within the Marsico Amendment? It is the role of the Federal Food and Drug Administration, the FDA, to do this research. Why should Pennsylvania taxpayers have to pay for this? Also, this points out the fallacy of the bill. If marijuana was so good as medicine, why do you need to do this research? Why do you even have this subject in the bill? Is the department doing this for any other medicine? No. Why is the state doing research to benefit the marijuana industry? Are there fees collected by the state to pay for this? Section 3017, establish and maintain outreach efforts about this act. Again, what is the cost of that? Is this being done for any other medicine? No. This helps the marijuana industry to market their products. The state, the government, is complicit in violating federal law. If this bill is passed, the marijuana industry will then turn their lobbyists loose on the department to increase their market share. They will try to get more and more products and conditions added on. They will file appeals if they are denied, and it will be endless lobbying and potential litigation. Section 501, issuance of certification. Conditions of issuance. The bill provides that physicians can write certifications for marijuana, but that violates federal law. This is taken in action to facilitate the use of marijuana. These actions by a physician violate federal law by aiding and abetting, by acting with specific intent to provide the patient with the means to acquire an illegal, illicit Schedule I drug, marijuana, knowing that the patient intends to acquire marijuana. That's in a court case, Conant versus Walters. Section 501, subsection A, subsection 5, practitioner's professional opinion and review of past treatments. The practitioner determines the patient is likely to receive therapeutic or palliative benefit from the use of medical marijuana. There are no sound scientific studies supported medical use of marijuana for treatment in the United States, and no animal or human data support the safety or efficacy of marijuana for general medical use. Marijuana is a Schedule I drug, and under federal law, it cannot be used for any medical purpose. A Schedule I drug is one that has, as defined by federal law, a high potential for abuse and for which there is no legitimate medical purpose in treatment in the United States. And third, there is a lack of accepted safety for use of the drug or other substance under medical supervision. 21 USCA Section 812 of the federal law. This was upheld last year in federal court in the U.S. versus Pickford case. This means that both doctors and pharmacists can be sued for malpractice for helping to procure marijuana for patients, and it turns out that it harms the patient. Section 501B, contents. 501B6, any requirement of or limitation concerning the appropriate form of medical marijuana. There's a serious flaw in this section. This cannot be determined for marijuana at all. At minimum, information on any medicine should include indications and usage, dosage and administration, dosage forms and strengths. contraindications, warnings and precautions, adverse reactions when mixed with other drugs or even alcohol, drug interactions, use in specific populations, drug abuse and dependence, overdosage, description, clinical pharmacology, non-clinical toxicology, clinical studies, references, how supplied, storage and handling, patient counseling information. Ladies and gentlemen, this does not exist for marijuana. Why? Because it's illegal under federal law and not medicine, as it is not approved by the FDA process. You know, there's a huge misconception that people are going to be able to get a prescription from a doctor, go to a pharmacist, and get their marijuana. That's not the way this works, ladies and gentlemen. If this passes, you can only get a recommendation from a doctor because it's illegal under federal law. They can't prescribe or write you a script. And you can't go to a pharmacy to get this so-called marijuana because it's illegal at the federal level. You got to get it from a pot shop, a dispensary, euphemistically called. But in Colorado, California, Washington State, they're all called pot shops. So the lawful use of medical marijuana, though unlawful at the federal level, there's another section. And it goes into limitations on medical marijuana and what the practitioner can do, but it lists medical marijuana may only be dispensed to a patient or a caregiver in the following forms: pill, oil, topical forms including gel, creams, or ointments. Do they have evidence that any of this, under scientific studies, longitudinal, randomized, double-blind, placebo-impacted studies actually work? Goes on to say that it allows for a form medically appropriate for administration by vaporization and or nebulization, tincture or liquid. This is interesting. The bill will allow marijuana concentrations to be ingested in many ways. Oil, a concentrate usually used in vape pens or vaporizers, but it can be placed in food or drinks. You need to look at Section 705 in the bill. In some cases, it may not be the intent, but in some cases, edibles can be used. Vaporizers. A liquid or solid form of oil can be vaporized. Pills with cannabis oil in them. Dabbing. Dabbing is a drug culture method of consuming concentrates. A dab of a concentrate is placed on a heated surface. The heat vaporizes the concentrate, which is then inhaled. It can create very high levels of THC delivered very quickly. This provides for the use of marijuana concentrates. Marijuana concentrates are made by the removal of the plant matter and then extracting the resin to obtain the THC. The technique for this may be different depending on which concentrate is sought. A marijuana concentration is an oil that concentrates the marijuana's chemical compounds such as THC and CBD. The end result is a highly potent oil that has varying consistencies. A solvent is used to extract that oil. At the end of the process, the solvents and plant materials are removed from the concentrate. Butane or CO2 can be used as solvents. With solvents, it's unlikely for them to be fully removed from the concentrate. CO2 extraction is more popular as it's relatively harmless, while consuming butane is dangerous. In the Health Committee, we had testimony in one of our hearings that indicated many terrible fires in Colorado resulted as a result of this process. Many people were hurt. There were many losses, casualty losses, fire creating this through this process. Section 503, in accordance with Section 1108, this one is a very difficult one, and this one would allow potentially for the smoking of marijuana. Section 1108. Really? You want to provide smoking to everyone in Pennsylvania? Sad, really. Section 503B3, in accordance with Section 1108, medical marijuana may be dispensed to a patient or a caregiver in dry leaf or plant form. As Lieutenant Kenda would say, oh my. Section 1108 allows marijuana leaves to be used. Of course people will smoke it. If it can be dispensed in plant form, does that mean marijuana plants? Of course. Will people be able to grow their own? Will caretakers be able to have plants for 5 patients? It gets out of hand. THC, medical marijuana in this bill is at a 10% level. The THC is the psychogenic, hallucinogenic property in marijuana that gets people high and in many cases stoned. THC is the intoxicating chemical in marijuana. The bill permits a high concentration of THC of 10%. The average THC concentration in marijuana has been 1 to 5%. A THC level of 10% will certainly get people high. I'm astonished that the pro-marijuana lobby actually thinks this limit is too low. Are you kidding me? More than 65% of medical marijuana users have experienced an overdose. The bill will permit high levels of THC, the intoxicating element of marijuana. Dr. Scott Novak, Senior Developmental Epidemiologist at RTI International, a nonprofit research institute based in North Carolina, has warned that more than 65% of people who use marijuana for medical reasons have experienced an overdose. And for those of you that still espouse and like to say that this is just a wonderful panacea and a great medicine, if that's true, why does the National Drug Court Association say there are more mentions in emergency rooms for marijuana than heroin? Why is it that the PH4 here in Pennsylvania can document nearly 100,000 hospital admissions for people with substance abuse for the treatment of marijuana? Marijuana is dangerous. It can be abused, and it can be used in overdoses. Section 1108 allows marijuana leaves to be used. Of course people will smoke it. What do you think they'll do with it? They're not going to use it for potpourri. It's a major inconsistency and conflict. It's a loophole in this legislation, a dangerous flaw to allow people to smoke anything. As the health chairman, we've heard testimony after testimony smoking anything. I don't care if it's corn silk, if it's tobacco, or it's marijuana. Anyone knows with any common sense that it's harmful to your health. The bill allows marijuana oils and liquids to be used. They will certainly find a way to put those in edibles such as cakes, cookies, ice cream, candy, by patients and caregivers. Caregivers can have up to 5 patients under this legislation. These edibles obviously will be attractive to kids. Emergency room and hospitalizations of children because this leads to toxic levels of consumption. It is indisputable the factual reports of children in emergency rooms and hospitals. Why am I so passionate about opposing this legislation? I don't want to see children get hurt. We have report after report in all 323 states that children are being hospitalized, they're being admitted to emergency rooms, they're getting sick, people are in tremendous traffic accidents because of drug driving. We need to be very, very careful what we're doing here, ladies and gentlemen. No wonder every major medical organization opposes it. They live by an oath, a creed, a motto, do no harm. Marijuana has not proven to be safe and effective for the conditions mentioned in this bill. In Section 103, it lists, oh my goodness, 15 different conditions. And many of them, marijuana, scientifically and evidence-based, actually harms these conditions. And of course, in every state that we've analyzed this, the catch-all really is the 15th one, pain. 80 to 90% of the people in other states just claim pain so they can get their marijuana. Very few actually fit into the other categories, the other 14 categories. 15 medical conditions basically allows anyone in Pennsylvania that wants marijuana to go and get it. Irresponsible. Marijuana has not proven to be a safe and effective medicine for the conditions mentioned in the bill. What are the requirements for an accurate scientific medical study of the effectiveness of marijuana for any condition? Unless the study meets the strict criteria under federal law, it's not medicine. Just because you call marijuana medicine doesn't make it true. Oh my goodness, if you're going to bypass the FDA approval process, what's next? Marijuana is listed as the most illicit drug in America. And it's listed right next to other illegal drugs, bath salts, LSD, all kinds of other drugs. Legalize marijuana, what's next? We're going to legalize heroin? This is ridiculous. What you need, if you're going to call something medicine, is independent verification. The study is not financed by any industry who has a financial gain. It must be randomized controlled trials where the people being studied are randomly allocated one or other of the different treatments under study. The study done on a significant patient population. The study must be peer-reviewed and published in a respectable journal dedicated to medicine or other particular illness. There must be a controlled comparison to existing medications for the particular illness. Is marijuana good for cancer? Positive status of human immunodeficiency virus or acquired immune deficiency syndrome or a whole host of other diseases? Some of these illnesses are included in this bill as illnesses that marijuana can be used for. However, the Journal of the American Medical Association discusses these illnesses and if marijuana is safe or effective for these illnesses, and they clearly say they are not. So why are they in this bill? So-called medical marijuana has been sadly approved in too many states for a number of conditions. Medical marijuana differs significantly from other prescription medications. Evidence supporting its efficacy varies substantially and in general falls short of the standards required for approval of other drugs by the U.S. Food and Drug Administration. Some evidence suggests that marijuana may have efficacy in chemotherapy-induced vomiting, but for most, these conditions, medications have already been subjected to rigorous approval of the FDA approval process. Use of marijuana under this legislation during pregnancy can cause birth defects and serious medical conditions and birth defects in offspring. Believe it or not, this bill will allow pregnant women to use medical marijuana. The American Medical Association has warned marijuana use may be linked with low birth weight, premature birth, behavioral and other problems in young children. Studies link marijuana use in pregnancy with childhood attention problems and lower scores on a problem-solving measure. THC, the intoxicating ingredient in marijuana, has been found in the milk of women, and data suggests the drug can affect the quality and quantity of breast milk. Marijuana has not been proven to be safe to use during pregnancy or breastfeeding. Marijuana use has also been linked with birth defects and childhood cancer. Cancer. This is very troubling under cancer. You've got cancer in this category. The bill permits the use of marijuana for cancer. Marijuana legalization advocates would have you believe that marijuana is the only alternative for cancer sufferers who are going for untreated for a various number of maladies. However, numerous medications and treatments are currently available, and I have a list of 30 of them. I will not state what they are, but there's a lot more than that. There are already FDA-approved THC medicines for chemotherapy. So why do we need this? If we already have THC-approved medicines, the bill provides for the use of marijuana for cancer treatment. However, there are already two forms of FDA-approved THC-based medicine that can deliver very controlled doses of THC to a patient in the form of a pill. This bill, however, will allow for uncontrolled doses of THC. Marinol can be used for control of various conditions. It's an FDA-approved drug, is covered by medical insurance plans, and can be obtained at local drugstores. It's approved for chemotherapy-induced nausea and vomiting. Conversely, marijuana is not covered by insurance. Again, why is it not allowed or covered under insurance? It's illegal at the federal level. The bill only lists where you can get it, and it's at a pot shop. You got to go to a pot shop to get this. There's another FDA-approved THC medicine named Sesamid. Sesamid is approved for chemotherapy-induced nausea and vomiting. It's for the treatment of weight loss for patients in AIDS. These medicines have proven to be safe and effective, and they are approved by the FDA. Some people who use marijuana claim that these medicines do not work. That is because they have a tolerance, perhaps, for THC at that particular level. So all a doctor has to do to overcome that tolerance is increase the dosage, and it may work more effectively. So why should Pennsylvania reinvent the wheel? The other problem with this bill is cancer has not really been properly defined. Does this also include skin cancer? So now you can go get marijuana to treat your skin cancer? Does it include cancer in children? What about pregnant women who have cancer? Marijuana use by pregnant women can cause birth defects. Marijuana use is now strongly connected to the onset of mental illness such as schizophrenia and depression. Do we want people with cancer to develop depression and other mental illnesses? The American Psychiatric Association states that current evidence supports, at minimum, a strong association of cannabis use with the onset of psychiatric disorders. Adolescents are particularly vulnerable to harm given the effects of marijuana on neurological development. There are many types of cancer and cancer treatments. In fact, there are over 160 types of cancer. Is marijuana oil good medicine for all cancers? For example, let's consider testicular cancer and AIDS-related cancer, Kaposi sarcoma. Let me just focus on Kaposi sarcoma because this is very, very troubling. A recent study from Harvard Medical School shows that marijuana use in any form opens actually the door for Kaposi sarcoma. Are you willing to accept responsibility for giving somebody who has cancer or treated for cancer? It's now going to get complicated because they're going to develop a new cancer, Kaposi sarcoma? This is a serious life-threatening cancer for people with HIV infection. An unintended consequence of using marijuana oil is it may harm people with HIV/AIDS. We do not want to treat people with HIV/AIDS with marijuana that could trigger Kaposi sarcoma. Again, here we are. Last time I checked, there's no doctors here in the House of Representatives, yet we're playing doctor. We're trying to define what medicine is. This is not right. We should leave this to the experts, to the medical and scientific field, to the FDA, to the objective clinical science. Okay, now let's get to the epilepsy and seizures. The National Epilepsy Society, the American Epilepsy Society, does not endorse the use of marijuana. They strongly oppose it. They've sent me 2 letters, one a year ago and then another one over the weekend. And in their letter, they actually say that marijuana can create adverse, serious impacts and reactions and increase seizures. My goodness, I don't blame mom and dad that have a child with seizures to try almost anything. But we deserve to give them the best medicine that America can produce. And just because we call something medicine doesn't make it true. And when the leading organization in this country does not endorse it and warns against it, and yet says, wait, let us do more research. Let us get into an Epidiolex clinical trial. I support that. I think we ought to have a state-expanded access program for Epidiolex. And you know what? The researchers are now in phase 3 of this drug. And it could very well be approved next year. And it will help many children with epilepsy. But many of the medical associations still say that it might only be 20 to 30% that will get helped. I hope it's a lot more than that. And we need to expedite that process and give them access to Epidiolex as soon as possible. Every case of epilepsy is different, and the disease is highly variable. Scientific studies help the entire epilepsy community to understand how and why various treatments work and for whom they are effective. Research also helps us understand the correct dose, side effects, and potential interactions with other medications. My goodness, if all you can get is a recommendation from a doctor, not a script, and you can't go to the pharmacy, so you're going to end up with marijuana But we don't know how that's going to interact with other drugs that children, through their neurologists or otherwise, may be taking. Do no harm. We don't want to do any harm to these children. We don't want to rush into something that is irresponsible and harmful to these children. One of the reasons I'm so passionate against this is I don't want to see children hurt. We need to rely upon doctors. People go to doctors to get help for their medical conditions. They don't go to pot shops. That just doesn't make sense to me. At present, the epilepsy community does not know if marijuana is a safe and effective treatment, nor do we know the long-term effects that marijuana will have on learning, memory, and behavior, especially in infants and young children. We need to be very, very careful in making sure we don't hurt children. Marijuana use could have some anti-seizure property, and I sure hope it does. But it's irresponsible to give them high levels of THC. We're drugging them. THC, under this legislation, gives them the hallucinogenic, psychoactive drug, and most researchers say you don't need that. Epidiolex is a purified form of a derivative of marijuana. It's safe. At this point, all the studies seem to indicate that it's safe and it could be very, very effective. I think we need to expedite that process and get that out to the children as soon as possible. If marijuana is to be used for children, it should be subjected to the same evidence-based review and regulatory oversight by the FDA. As the authors of a recent article in the journal the American Medical Association wrote, potentially therapeutic compounds of marijuana should be purified and tested in randomized, double-blind, placebo, and active controlled clinical trials. Toward this end, the federal government should actively support this research examining marijuana's potentially therapeutic compounds. But these compounds should be approved by the FDA, not by popular vote or by the legislature or by politicians or by emotionally driven advocacy, manipulation by some of these marijuana groups. These children can be helped without opening a Pandora's box and putting them at great risk of harm. The unknown should only be risked if FDA-approved medications have failed, and then these oils should only be used as part of clinical trials. Pennsylvania should take note of New York State's efforts to help children with medication-resistant epilepsy. These children can receive a promising new medication based on the non-intoxicating component of the marijuana plant. This bill allows for the intoxicating component, and it's a tell as far as I'm concerned. The tell is they want it available for everyone else because they like it, they like the high, and they like the effect of this ingredient in THC. The state of New York and GW Pharmaceuticals have agreed to work together to study investigational cannabinoid, Epidiolex, for the treatment of children with medication-resistant epilepsy, and we should do the same here in Pennsylvania. And I believe the Department of Health is already working on an expanded investigational program for, it's modest, I think it's maybe only involving 50 children, but I applaud them for doing that. I think that's a good start, but we could do a lot better. There's about 600 children that have these rare forms of epilepsy in Pennsylvania. We ought to put every one of those now, not later, not 18 months from now when this all goes into effect. We ought to put those children in this program right now. Try to help them.
Mr. Speaker.
Yes, I'm sorry. Representative Dermody, sir.
Mr. Speaker, we are
please
on the
tell me what
Marsico amendment on second consideration. I believe much of this discussion should be for final passage. We've gone far afield from the substance of the Marsico amendment.
Thank you. The amendment is substantive and covers a good bit of ground. But Representative Baker, if you could please, if you could just address the points with respect to the Chairman Marsico amendment. Thank you very much.
Yes, sir. I oppose the Marsico amendment because I have serious concerns for the risk and harm that marijuana use will have on children. The American Society of Addiction Medicine just published a great article on this. And they're very concerned, and it's why they oppose this legislation and the Marsico amendment. Another disease listed in the Marsico amendment that I oppose is the Parkinson's disease. That should be eliminated from this amendment. There are no randomized controlled trials with cannabis for this condition. So why is it in here? Until there are proper studies for this condition, it should not be included. We may be doing more harm than good. Multiple sclerosis is also listed in this legislation. Again, the multiple sclerosis people don't support this legislation. They don't support this amendment. So what do the multiple sclerosis experts say? Based on studies to date, it's their opinion that there are currently insufficient data to recommend marijuana or its derivatives. Again, we need more research. We need science-based evidence. The MS Society also stated the question of whether marijuana produced from marijuana plant should be used for symptom management is a complex one. They call for additional studies. Until marijuana is proven to be safe and effective, it is best not to use it as medicine. We need more research. We need more science-driven evidence. Okay, let's get into PTSD. That's also listed in the amendment. Again, there's too many diseases that are listed that aren't proven to be helpful under care of medicine, under marijuana. There are no large randomized clinical trials with cannabis to alleviate PTSD symptoms. On the contrary, cannabis use may actually impede the effectiveness of treatment for PTSD and is associated with poor clinical outcomes with PTSD. The National Center for PTSD opposes using marijuana. And, you know, I keep thinking about this work group that put all this together. Didn't they confer and get advice from all these medical organizations? Oh my gosh, why are they listing all of these diseases when the experts in the country do not support their body of work? In fact, it's an indictment against their body of work. They don't support what this work group put together. And by the way, for some reason, I wasn't invited to be on that work group. Marijuana use for medical conditions is a growing concern. Some veterans use marijuana to relieve symptoms of PTSD. However, controlled studies have not been conducted to evaluate the safety or effectiveness of medical marijuana for PTSD. Again, just because you call it medicine doesn't make it so. There's no evidence at this time that marijuana is an effective treatment for PTSD. In fact, research suggests that marijuana can be harmful to individuals with PTSD. The American Academy of Addiction Psychiatry indicated regarding marijuana for PTSD patients associated with severe symptoms and violence, they affiliated that, they associated that. And in their study, those who never used marijuana or who quit using did the best. They also noted despite state laws approving its use, there is very little evidence to support using marijuana to treat PTSD. Again, marijuana is dangerous for people with HIV/AIDS. We do not want to do harm for people that have HIV/AIDS. But the biggest catch-all in all of those diseases is the one listed in the amendment that involves pain. This is very subjective and will open this up for widespread abuse, as happened in other states where they have pain as a condition. A study examining California's patients found the average patient used that category in terms of getting access to marijuana. Again, I want to go now to Section 701 concerning safety inserts and how that impacts dispensary and dispensing medical marijuana to a patient or caregiver. They're calling for an insert that provides certain information, lawful methods for administering medical marijuana in individual doses, any potential dangers stemming from the use of medical marijuana. Because this has not gone through the FDA process, there's no way to safely list the dangers. We don't know all the dangers that we find out there by bypassing the FDA. In terms of packaging and labeling, this should be done with an FDA package insert on a prescription medicine. This legislation doesn't provide any of this. Again, flawed. We are sure that the department wants to manage the risks of medication use and to reduce medical errors. The department must require the most up-to-date information in an easy-to-read format that draws physician and patient attention to the most important pieces of drug information before a product is used. Providing practitioners and patients with clear and concise information about marijuana as a medicine will help ensure safe and optimal use of it if and when it becomes available. At minimum, the information of marijuana should include indications, usage, dosage, forms, strengths, contraindications, warnings, precautions, adverse reactions, drug interactions, use in specific populations, drug abuse and dependence, overdosage, clinical pharmacology, non-clinical toxicology, clinical studies, and patient counseling information. The problem is we do not have all the information for marijuana because it did not go through the FDA approval process. Warnings. That is flawed as well under Section 4, subsection 4. The warning, keep out of reach of children, should explain what harm it can cause children. It does not. That is flawed in this legislation. There should be warning labels such as marijuana use increases the risk of serious problems with mental and physical health, including addiction. Marijuana should not be used by persons prior to operating motor vehicles and heavy machinery. The bill should require that marijuana products be sold only in child-proof packaging and be accompanied by the mandatory distribution of educational flyers regarding the risks of overdose and poisoning in cases of accidental ingestion by children or even household pets. And this has been clearly documented in the 23 states that has, in one form or another, legalized marijuana. Section 707, this section initially limits the number of growers to 25 and the number of dispensaries to 50. How are those selected? Tax on medical marijuana. This is interesting. So we're going to tax medical marijuana now. The proponents of medical marijuana argue that the state's financial woes can be alleviated by taxing medical marijuana. The state's financial woes are better dealt with than by taxing sick people. Why are we taxing so-called sick people? We shouldn't be taxing sick people. If the sponsors of the bill really believe that marijuana is medicine for sick people, why are they taxing sick people's medicines? The advisory board was set in the bill, and since there will be political appointees to the board from the governor, and by the way, as you all know, the governor supports marijuana legalization. In fact, I just saw where he's spending money on this in ads now. So the governor's pushing pot and its legalization. I find that astounding, how times have changed. I have a concern with Section 2104 under schools. Can dispensaries or grow operations be located near schools, daycare centers, playgrounds, parks, and other places where children congregate? This area has an incredibly high potential for abuse on the part of qualifying practitioners and liability issues inherent there too. Very concerned about the medical marijuana dispensaries that are being set up and created, how we're allowing for vaporizers to be used in the delivery system of marijuana. We've seen many problems with vaporizers. We've seen pictures of explosions of vaporizers and people in comas. They need to be highly regulated. They're not. And yet, we're allowing marijuana to be used in the vaping process. The FDA has not approved vaporized products, except to treat pulmonary conditions because of the side effects of delivering active molecules directly to the lungs and brain.
Will the gentleman suspend, please, for 1 minute? We have some housekeeping stuff. Rebecca Neer, WPMT Fox 43, has been permitted by the speaker on the floor doing some B-roll. She will be on the floor. Oh. Rebecca Neer, WPMT Fox 43. Also want to report Representative Christiani is on leave. Thank you, Mr. Chairman.
Thank you, Mr. Speaker. You'll be delighted to know I'm going to be wrapping this up very soon. My last comment on vaporizers. Using vaporizers as medical devices without FDA approval violates federal law 21 CFR 801.5, 21 CFR 803.3, medical device reporting, 21 CFR 807.93, pre-market notification procedures, 21 CFR 808.3, medical device classification. There are many, many problems with this legislation. It's in violation of federal law. And I have never, as chairman of the Health Committee and one of the more senior members here in the Commonwealth of Pennsylvania, ever seen another case, another bill that's come before this august chamber where part of the summary says this bill violates federal law. This is in violation of federal law. What in the world are we doing violating federal law on so many levels? And I know many of you may be well-intentioned in the pursuit of this legislation. I understand that. But I think there's a better way. An expanded access program, investigational drug program, FDA oversight. Let's get the Epidiolex to the children. Let's help them. But opening this up to everybody else in Pennsylvania that wants it, under the guise of medicine, is reprehensible, irresponsible, and we should not be legislating medicine. I oppose the amendment. Thank you, Mr. Speaker.